This is your cervical spine in its natural state. A gentle C-curve designed to effortlessly support the weight of your head. Your head weighs about 10 to 12 pounds. In a neutral position, your spine balances this weight perfectly against gravity. The moment you tilt your head just 15 degrees to look at your phone, that gentle curve begins to straighten out. At a 30-degree tilt, gravity takes hold. The leverage changes, and the actual workload on your neck muscles doubles. This is severe text neck. At 60 degrees, with your chin near your chest, the physics of your spine completely changes. Compare the two. The loss of the natural curve is obvious. You are forcing your spine into an unnatural structural weak point. Due to leverage, at a 60-degree angle, your 12-pound head exerts a massive 60 pounds of force on your neck. Look at the top vertebrae, the atlas and axis. They shift out of optimal alignment, stressing the very top of your neck. It's not just the neck. Looking down pulls the entire upper back forward, creating a hunched, rounded posture. The front of the neck compresses, shortening the jawline structures and anterior muscles in a chronically tight position. Focus on the back of the vertebrae. These facet joints are jammed together, compressing tightly with every forward tilt. The front of the vertebral bodies bears the brunt of the leverage, experiencing extreme pressure points they weren't designed for. The bony bumps on the back of your neck separate, stretching the ligaments that hold your spine together past their limit. Under chronic pressure, your body reacts by growing new bone. These are bone spurs, early signs of osteoarthritis. These holes are where your nerves exit. As you tilt forward, these spaces narrow, threatening to pinch the delicate nerves. The C5 and C6 vertebrae usually take the hardest hit. This is the most common site for severe text neck damage. The base of your skull gets jammed into extension, creating immense tension right where your head meets your neck. A healthy joint is juicy and hydrated. Chronic compression dehydrates the joint capsule, making it stiff and prone to injury. Over time, the temporary straightening becomes permanent. You lose the natural cervical lordosis, even when not looking at your phone. Looking down the spinal canal, we see how vertebral misalignment can begin to narrow the space available for your spinal cord. Your posterior neck muscles, like the traps, glow red with tension. They are fighting a losing battle to hold your head up. The SCM muscle in the front becomes chronically shortened and tight, pulling your head forward even when you're relaxed. This is upper cross syndrome. Tight back muscles paired with weak front muscles creates a predictable pattern of dysfunction. The connective tissue, or fascia, around your muscles thickens and stiffens, acting like a tight straitjacket on your neck. Muscle fatigue sets in. Like a battery draining, your neck muscles lose their ability to support your spine during long phone sessions. A healthy cervical disc is like a jelly donut, plump and hydrated, providing a cushion between the neck bones. Like squeezing a water balloon, the uneven pressure pushes the inner gel of the disc backward toward your spinal nerves. This is an early disc bulge. The outer layer starts to weaken and push outward under the relentless pressure of text neck. Chronic compression squeezes the water out of the discs. They become thinner, darker, and lose their ability to absorb shock. The worst-case scenario: a herniation. The inner gel leaks out, directly irritating or compressing a sensitive nerve root. Compare a healthy disc height to a compressed one. The loss of space changes the entire mechanics of your neck movement. This is creep. Even low pressure over many hours slowly deforms the disc tissues, making them vulnerable to injury. The vertical forces on the lower neck discs are immense. It's like carrying an 8-year-old child around your neck all day. As discs thin, more weight shifts to the facet joints behind them, accelerating arthritis in the back of the spine. Tight muscles at the skull base compress the occipital nerves, a primary cause of tension headaches that radiate over the head. A pinched cervical nerve sends a loud pain signal. This glow represents the burning or shooting pain traveling down your arm. Extreme forward posture can even slightly compress the vertebral arteries, potentially affecting blood flow to the brain. Bad posture sends mixed signals from your neck to your brain, which can sometimes result in feelings of dizziness or imbalance. The tension is connected. Chronic neck tightness pulls on the jaw muscles, contributing to TMJ pain and clenching. The vagus nerve travels through the neck. Structural misalignment here may impact its function in regulating your body. This pain map shows the reality of text neck. Red zones of pain in the neck, upper back, and headaches behind the eyes. This is advanced arthritis. The smooth bone surfaces become rough and jagged, grinding together with every movement. End-stage degeneration can lead to natural fusion. Two vertebrae grow together, permanently losing all motion at that segment. The dowager's hump. Your body builds extra bone and fatty tissue at the base of the neck to protect the stressed area. Spinal stenosis. Bone spurs and bulging discs narrow the spinal canal, dangerously crowding the spinal cord itself. Chronic strain causes ligaments in the spinal canal to calcify and harden, further reducing flexibility and space. A permanently straightened spine is a structural failure. It loses its ability to absorb shock, transferring forces directly to the head. Chronic inflammation becomes the new normal. Persistent redness around joints indicates ongoing damage and pain. Long-term text neck steals your mobility. Stiff joints and tight muscles permanently restrict how far you can turn your head. The chain reaction goes down. Your lower back has to compensate for your neck's imbalance, creating pain lower down the spine. It accelerates aging. A 20-year-old spine with text neck can look like the degenerated spine of a 40-year-old. The fix is simple geometry. Raise your phone to eye level. Keep your neck neutral and let your arms do the work. The chin tuck is your reset button. Activate the deep front neck muscles to pull your head back into alignment over your shoulders. Squeeze your shoulder blades together. Retraction opens the chest and provides a stable foundation for your neck to rest on. Stretch the tight traps. Gently tilt your head to the side to elongate those overworked muscles on the side of your neck. Open the doorway. Stretching your chest muscles allows your shoulders to sit back, taking the passive tension off your neck. Mobilize the upper back. Using a foam roller helps reverse the rounding of the thoracic spine that accompanies text neck. Strengthen the back. Strong rear delts and rhomboids act as postural support, holding your shoulders back effortlessly. Sleep correctly. Use a pillow that supports the natural curve of your neck, not one that props your head up too high. Hydrate your discs. Drinking water is essential. Well-hydrated discs are plumper and better able to resist compression. The final goal is balance. Put the phone down regularly and return your spine to its perfect, pain-free, natural posture.